Good evening, everyone, and thank you so much for joining us for this special live streaming program and town hall meeting that we are calling Step Up for Your Community. My name is Greg Moss with the City of Westminster. I can't thank you enough for joining us tonight because over the next 45 minutes or so, we're going to be talking with professionals in the field about the health situation that we are all facing in our region. We're going to hear from our elected officials, our city and county managers, again, doctors who are dealing with this on the front lines. We have some of the frontline firefighters who are dealing with this, who are actually dealing with COVID themselves. And so our goal over the next 45 minutes or so is to engage you in a conversation. So we are looking for your questions as we hope to have some answers for you at the end of our program. If you are online right now, you may have a chat feature or a Q&A feature at the bottom of your screen. Please just send us your questions and we'll get to as many of those as possible by the end of the evening. You know, Westminster is taking the lead on producing this program tonight, but we could not do it without our municipal partners in our region. And I want to give them a big shout out right now as well. Thank you to the City of Brighton, the City of North Glen, and the City of Thornton. And we're going to be talking to some of those city managers here in just a few minutes. I had the opportunity to sit down with Governor Jared Polis via conference call, video call, a couple of days ago and pre-recorded an interview about what we're going to talk about tonight and get his take on where we are in the COVID-19 pandemic, what's happening and unfolding in the state legislature, and more importantly, his advice to us as we continue to move forward. Here's that interview. Governor Polis, thank you so much for joining us. Before we begin, I just want to check in on your health. How are you and the family feeling?
Thanks, Greg. So far, we hope we're among the lucky ones. You know, the single biggest number of hospitalizations are people 40 to 64, our age group, and it's about a 4% chance of hospitalization. So, you know, it means a 96% chance you don't need it, and we all hope we're in that 96%, but 100 out of 100 can't be. That's what odds are all about. So best to avoid this thing if you can.
Indeed. Well, I'm so glad you took time to join us this evening. We appreciate it. We're talking to municipalities all along the northern part of the Front Range here. I know you have a special message for us, and I would just love to hear it.
Well, thank you. It's great to join WestyRISE, Step Up for Our Community. I want to thank Emma Pinter, Adams County Commissioner, good friend, our Jefferson County Commissioners. Greg, thank you. Don Tripp, 9 News media partner. I know there's going to be a panels of community, students, and business leaders, and the audience across Adams County and Westminster, really wherever you are. Our fight against COVID-19 depends on the choices we make and a strong local response. And I want to particularly applaud the Adams County Commissioners for having the Water World testing site free, quick, and easy, up and going through the end of the year. You know, while we're faced with great uncertainty, we know that there's hope at the end. The vaccine works better than expected, 94%. There's even evidence now that even for those who it doesn't prevent the infection, it's much more minor. So we hope that that is borne out with future studies. But right now in Adams County, 1 in 39 people are contagious with COVID-19. And many might not know it because you might be asymptomatic and it could be deadly for your spouse or a friend. And for those who might have minor symptoms, please, it's so important to stay home and not infect others, because what could be minor symptoms for you could be deadly for somebody else. It is very much like a lottery. Here's what you can do. Avoid all personal gatherings, social gatherings with people outside your home. No, it's not the preferred way to live, and we'll be back to normal soon enough. But for the next few weeks, avoid social gatherings. 2, wear a mask around others when you're outside your home. You can wear a cloth mask, you can wear a surgical mask. They offer about 50% protection, even higher if it's a medical quality mask, but even 50% for a cloth mask, very much worth it. Keep your distance 6 feet apart from others. Wash your hands often when you come back from being out. Scrub for 20 seconds with soap and water. Stay home if you're sick. Please stay home if you're sick. And, you know, we also want to support our local businesses. Shop local where you can. Curbside delivery is safer. You can pick it right up. Keep your local businesses going. Order in, take out for food. We appreciate our local businesses, and get tested. I mentioned Waterworld. Now there's curative testing vans throughout the metro area. You can find one of the 80 free testing sites, covid19.colorado.gov/testing. So thank you for watching. Let's be smart, let's be safe, and let's get through this. Back to you, Greg.
Oh, Governor,
Thank you so much. You have been a tremendous advocate, you and your administration, in getting the word out about wearing the mask and distancing, limiting our exposure, obviously. And yet you still contracted the virus. I know you're hearing this from some people who might think, look, if he did all of those protections, he still got the virus. What chance do I have, and why should I still be vigilant? I know you have a strong message about that.
Well, look, we have something that prevents 50% of the cases today, and that's called a mask. 50%. I mean, they were going to release a vaccine if it was 50, 60% effective. Thankfully, it's 94%. But if it was 55, 60% effective, it would be no more effective than a mask, but it would still be released. We have that today. Does that mean it guarantees you won't get it? No, of course not. It's like wearing a seatbelt in a car. If you're wearing a seatbelt, does it mean you won't die in a car accident? No, it doesn't guarantee you that, but it increases your odds a lot, right? So wear your seatbelts and wear a mask and avoid social gatherings. Lives will be saved. It could even be your own.
On the state's COVID dial right now, we have added a purple level that allows counties like Adams and Jefferson to hold off on going back to the lockdown that we saw, in the springtime until our hospital capacity obviously is overwhelmed. Given where we are today and the amazing numbers, unfortunately, that you just mentioned, especially in Adams County, do you believe that there's any way that we can avoid another lockdown moving forward here in the next 30, 60, 90 days?
Well, I sure hope so. Adams County entered red status some time ago. What that means is there's hopefully less mixing in commercial environments. That needs to be complemented by the residents of Adams County choosing to socialize less in their personal lives too, right? That's not something that government, the commissioners, the state can really say. We can, certainly say you can, dine outside, be safe, don't pack into restaurants or bars. But what people do in their own lives is your own decision. And I'm just urging Adams County residents in this critical time where 1 in 39 people are contagious with COVID, do the right thing. Avoid socializing with people outside of your household. You could save your uncle's life, your aunt's life, your parents' life, and it might even be your own. And even if you're one of the somewhat lucky ones who makes it, if you have to be hospitalized, that is no fun. I've talked to too many survivors of this, Greg, who've been hospitalized a week, 2 weeks, 3 weeks, 4 weeks, that emerge, weaker, thinner, and just taking many, many months to even get up to back to where they were.
Indeed. Very good point there. Let's talk more about hospitalizations for just a moment. In our region, as you know, our hospitals are warning that they are quickly running out of bed space as these hospitalizations continue to grow. How close are you to ordering overflow facilities like the one we have at about 84th and Federal, the old St. Anthony's North, to being reactivated and preparing to open? How close are you to that?
Yeah, so St. Anthony's North, along with St. Mary's in Pueblo, Convention Center in Denver, they're prepped, built, ready to go. Just need a week or two to fully activate or activate the first beds there. So we monitor every day in real time hospital beds. And so we follow the model. It's getting close. We're still in our capacity right now. And there's some surge capacity at the hospitals, but we stand ready to make that call when we need to make that call.
You called the General Assembly back into a special session this week. You have $200 million plus from an emergency fund to specifically you wanted to earmark for small businesses, people about to lose their homes, and more additional kind of support on the social services side. What will success look like to you at the end of this special session?
Well, I'm just so proud the way that Democrats and Republicans are coming together to help Colorado in its time of need. Many people know that the legislature normally starts meeting in January. Well, you know what? That's simply too late for many small businesses and Coloradans. That's why we called them back. Here we are. I think they'll get their work done in the next few days. Help for renters and landlords to avoid evictions and foreclosures, food banks, childcare, and then aid for so many businesses that are feeling the brunt of this, like restaurants and bars and gyms, just a way that we can step up and make sure that we say, we appreciate what you do. You're an important part of our community. Let's help you get through this time until the good days return.
Speaking of that, I had a chance to watch your talk and discussion and interview with Dr. Fauci as part of the special session. You mentioned that we're so close. I guess your final word today is to be patient and hang in there because we are very close.
The first Coloradans will be getting vaccinated in about 2 weeks, Greg. Now, that's unlikely to be many of your viewers. That will first be the healthcare workers. My goodness, I just thank them every time I see them. Going into COVID wards and putting themselves at risk, and we're so grateful. And we believe that most, if not all of them, will get that vaccine in December. Then, starting in January, rolling out to broader groups, starting with older and more vulnerable Coloradans. But it is only a matter of time. A few more months, we should have sufficient coverage of the vaccine to effectively end the crisis, end the pandemic. Now, that doesn't mean no one's going to get COVID in a year, and 5 years, and 10 years. It's here to stay. But all this issue around hospitals worrying and huge death toll, that will dissipate as soon as enough people get the vaccine. Just as there's still tragically people who die of preventable diseases like measles today, it exists. But most of us enjoy a high degree of protection because of our vaccines.
Governor, stay safe and healthy. To best to you and your family, and thanks to you and all of our elected officials for your leadership. We appreciate it.
Thank you, Adams County.
Thank you, Adams County and Jefferson County, too. Bye.
And Jefferson.
Indeed, we talked to the governor just a couple of days ago. Of course, the special session of the legislature has now ended. 10 total bills are headed to the governor's desk for signing. Let's recap what progress was made during the session and what was passed, and exactly how much money has been earmarked for certain areas, especially on the business side. We've got $45 million set aside now for emergency relief for childcare. We're going to have a temporary sales tax reduction. That's for restaurants and bars specifically. More local control on food delivery fees. We've heard a lot about that in many municipalities of late. Insurance premium tax credits will help establish a small business loan program, and $57 million is being set aside now for small business and arts organization relief. On the community side, about $20 million will be going into internet access expansion. That's specifically for remote learning. That's so important now in our schools. $5 million for food pantry support, $44.5 million for housing relief, $5 million for utility assistance, and about $100 million will continue to be put back into this disaster relief fund, specifically earmarked for COVID-19. It takes a lot of leadership in all of our cities to really lean into a challenge like this. Tripp is the city manager for the city of Westminster. He happens to be a colleague of mine and my boss as well. We are proud to be joined by him right now. Don, thank you so much for taking some time out this evening. We appreciate it.
Thank you very much, Greg. I'm glad to be here, and I want to also thank our regional partners for participating in this evening. Thank you.
You know, I'd like to talk just a few minutes about the challenge residents and businesses of Westminster are facing as we're dealing with yet another surge, and maybe a surge on top of the surge.
Well, Greg, everyone is frustrated, first of all. They're frustrated by the lack of human interaction we've had to become accustomed to. But many are also suffering due to illness, family tragedy, and financial insecurity. People are scared, and they're exhausted by this uncertainty, and they're wondering how long until our normal returns.
You know, Westminster, very early on, started taking the lead and offering residents and businesses a lot of different kinds of support in this very difficult time. Talk a little bit about what kinds of support is now available.
Westminster has been the city at the forefront of action from the beginning of this pandemic. We're the first city to enact the mask ordinance. We went into our reserves to help businesses before national CARES funding was available. We provided free masks for businesses. We have promoted our local restaurants, and we have subsequently provided multiple programs to help with money to businesses and residents to help pay their rent, for their water bills, to buy PPE. We've had programs that you've been involved with, Greg, to provide food to our neighbors. We've kept our workforce employed in the city. We're really proud of that. By having some reserves, we've reassigned many of those staff that were doing other activities that have been closed to alternative work, to work in our community. And we've had a very visible multimedia campaign to keep people informed. Finally, the thing I'm probably the most proud of right now is last night we launched a program called WestyRISE Recovery and Resilience. It's a gathering of neighbors that are strategizing to make sure that everyone recovers equally. In most of these economic downturns, the most threatened and struggling neighbors recover the slowest, and many times never completely. So we are talking to folks, Greg, to understand what services they will need to get back on their feet. I just want to let everybody on this webinar know to please contact us if there's any way you think the city of Westminster can help you.
And we'll let folks know how to do that here in just a few minutes, Don. You know, you have a lot of experience in public service. You've had to deal with lots of natural disasters over the years of your career. But a pandemic, I think you would agree, is extremely different. Talk a little bit more about the differences and what you're facing as a result.
You know, that's correct, Greg. I've worked in cities through floods, winter storms. I've witnessed the heartache of immediate death and injury. Those incidents were relatively short compared to this pandemic, and I think that's what distinguishes this event to any other event. This event, I'd say, is more akin to when this country has faced wars that lasted many years. But I want to say in those times, patriotism rose. And I'd like to suggest that we band together, like in those historic patriotic responses, and realize that we are all in this battle together. Wearing your mask, the sacrifice of avoiding interactions, and getting tested and vaccinated, I think can be viewed as that kind of selfless patriotic response. In times of crisis, we see our communities pulling together. We've witnessed our community of Westminster pull together in so many ways through this crisis. But you know, unfortunately, we've also seen the pandemic used to create division, skepticism, and fuel hate. I just point this out because I want to ask everybody to really think about this. Know that we're all in this together, that more than anything else, we need each other right now. And we need kindness, empathy, and compassion.
Some very good advice, Don. You know, the residents of Westminster, I think you would agree, have done an amazing job of respecting the health orders that have been issued by both the state and the county. We've heard feedback, though, from some people. Look, the recent surge isn't a Westminster problem. And perhaps some people feel that, you know, we shouldn't have to face more restrictions if we're doing such a good job. What's your response to that kind of feedback?
You know, I was very taken with the comments of the governor and what he had to say that was with great resolve. I want to tell you that I think the Westminster's done a good job, but it needs to keep up and it needs to improve. As good a job as we've done and our cities around us, the numbers speak for themselves. A little data point for everybody. In July in Colorado, 1 out of 600 people that you encountered were infected. Today, that number is 1 out of 45. And you heard Governor Polis say it's 1 in 39 in Adams County. So think about it like this. If you are encountering at least 45 people within 6 feet and not wearing a mask, you are at great risk. The pandemic knows no borders. It doesn't care where you work, where you live, how much money you make, or what kind of education you have. It looks for opportunity. And we're almost at that finish line. We just need the entire team to get us across together.
Don Tripp, thank you very much for joining us. Stick around. We're going to bring you back on in the Q&A portion at the very end of the program, but we appreciate your comments and your insights, and I'll see you in just a few minutes from now. If you would like some more information about what City of Westminster is offering specifically for resources and offering ways to give some input into the new opportunities that Don was mentioning, just head to our main website, cityofwestminster.us, and then put /COVID-19. That's COVID-19. You'll find lots of resources there. As you heard Don mention, it takes a village, really, to lean into a challenge like this. And our elected officials have been really leaning into this for many, many months. Westminster straddles, of course, Adams County and Jefferson County. Adams County has taken the lead on a lot of the different initiatives that we've been able to implement and help fund that through the CARES Act funding. I want to bring on right now Commissioner Emma Pinter with Adams County. Commissioner Pinter is a longtime resident of our region and a former city councilwoman for the City of Westminster. We'll talk more about that in a minute. But Commissioner, thank you so much for joining us. It's great to see you.
Hi, thank you so much for having me. Obviously, Westminster is my home.
Indeed.
And it's near and dear to my heart. And I'm really pleased to be here with Leslie Dahlkemper, who I've admired for a long time for her service on the Jeffco School Board and in the community. And she's been my partner this year. We've called and texted many a time. Jefferson County and Adams County have been committed from the beginning as two of the largest counties in the state of Colorado, that the minute we got our CARES distribution, to distribute that to our cities and set up innovative and first of their kind IGAs for that distribution to make sure that aid got to residents as fast as possible. And I have to say that in talking statewide and regionally, some of the other smaller counties had a harder time with that, and we're really privileged to be here where we have the systems and the infrastructure in place to be able to get aid out and to help each other And if one of us runs into an issue, that we're calling the other for help. And it's been a regional approach. And I think that's really true Denver metro wide, but right here in Westminster, I can assure you, both from a collegial standpoint as well as a management standpoint, Jefferson and Adams County have been working strategically together from the beginning to get as many resources to as many businesses and as many people as possible.
It does take a tremendous amount of partnerships. You mentioned those intergovernmental agreements that are in place now for a lot of these programs. It is unusual to see that move so quickly, so we thank you for that leadership. We're going to talk to Commissioner Dahlkemper in just a minute, but I want to talk a little bit about what we're hearing from residents in a lot of places. You know, we hear the COVID warnings from elected officials, health department leaders, city officials as well, and yet there's still pushback from some on that advice. And why do you think that's happening right now? And maybe some of the skepticism that may be out there. What do you say to folks who have a little hesitation to continue on? And certainly they're fatigued, I know that.
Right. Well, the fatigue is exactly right. I think folks are tired, and many of them have done right or have done as much right as they can all year and have put their best effort forward. And it is exhausting to feel like we're still in it. The governor set that benchmark that we have some positive vaccines coming. Hopefully 6-8 months, Q3 of 2021, we should have population-wide distribution. It's, you know, from our lips to God's ears that as FEMA coordinates with the state and our local public health departments, that those vaccines get distributed in that way. And that's where knowing that you have these partnerships, the state is here, your counties are here, and our municipalities are working together, that we will be sharing those resources as much as possible, as fast as possible. But I understand everyone who feels like we're just so close. And, you know, the city manager referenced this, working with disasters. If this had been a tornado, it would be over by now. And that's one of the things that's really hard, because we're still in the process of fighting the pandemic, and it's been unrelenting.
You know, as you mentioned, you're a longtime Westminster resident, former city council member for the city of Westminster, and we thank you for your service. From an Adams County bigger picture, region-wide perspective, what's your greatest concern right now?
My greatest concern is the lack of federal aid. I'm going to be really honest. We can do all that we can do, and I can assure you that we are searching every couch cushion. I know that Westminster is doing the same. The state just did this in an incredibly collaborative, very fast special session. I won't repeat the bills because you highlighted them, but we can only do so much. We can't and we shouldn't. We're legally not allowed to do any deficit spending. We have to spend only the dollars we have. We do have rainy day funds. I think if you're a small business owner, you would agree that it's raining. So we are trying to be as wise and strategic with our funds as possible, but without significant federal relief right now, we are going to have some hardships, particularly for our restaurant owners.
We are indeed, and it's been raining a long time for many of these restaurant owners and small business owners, so we got to get them another umbrella for sure. So thank you for that. I'm going to let you have a final word here and a message of hope for people who are watching, and of course the residents of Adams County.
Yeah, absolutely. I feel like the message of hope, Westy has long had a program where we shovel each other's stoops. So if you haven't ever signed up for the Snowbusters program, I'm going to plug a old Westminster City Council program to sign up to shovel your neighbor's stoop. It's not your driveway. It's not your sidewalk. It's your neighbor's driveway, to keep them safe so they can go about their business and be safe. And if you have a little extra privilege this year, order out, order from restaurants, call that restaurant directly and order for them. You know, skip those online fees and call that restaurant directly. It's your favorite restaurant. You want them to be there next year, give them a call. And if you have the chance to go out, make sure you wear a mask. We in Adams County have a lot of frontline workers. Nurses live here, police officers, firefighters live here, our teachers live here. We have distribution facilities. We are long known for having distribution and logistical facilities in Adams County. And that means that our people have been working this whole time. Yeah. If you have the privilege to stay home, please stay home.
Commissioner Penter, thank you for those words. We're going to have you stick around. We'll bring you back in the Q&A at the end of our program too. But for now, thank you very much. And really, I can't say enough about all the different programs that Adams County is offering. If you'd like to get more specific information about where you can find resources related to COVID-19, we've got a graphic here for you. Adams County COVID-19, all one word, .org is their main website. We don't have time to list all the different support programs that are available, but there are many for businesses, people who are in danger of perhaps losing their homes, small business loans, and other grant programs, and food assistance, of course, as well. Commissioner Emma Penter from Adams County, thank you.
Todd Levick with 5280 Burger Bar in Bradburn Village in beautiful Westminster, Colorado. Burgers are comfort. A good burger is great. 2020 for 5280 Burger Bar has been challenging, imaginative, been uplifting all at the same time. We are blessed to have such a great community that supported us throughout this whole experience. It's not over, and it's not going to be over for a while. Let's just keep boosting each other's energy and being positive through this, so it doesn't become just a ho-hum, I'm tired of this, I give up. Be kind to one another. Remember, we're all working hard. Support your local businesses by slowing the spread, and wear your mask.
Boy, we can't emphasize that enough, and support those local businesses and restaurants. Thanks to the team at 5280 Burger Bar there in Bradburn Village in Westminster. You heard Commissioner Penter reference our next guest, Commissioner Leslie Dahlkemper from Jefferson County. She too has been working tirelessly on the efforts of COVID-19 recovery and dealing with the surges that we're in right now. Commissioner Dahlkemper, it's great to see you this evening. Thanks for taking time out of your busy schedule.
Well, thanks so much, Greg. It's great to be here with you and WestyRISE partners as well. I just have to give an extra shout out right back to Commissioner Penter, whose leadership during this time, along with the entire Adams County Board of Commissioners, has been truly incredible. And we're so grateful for the cross-county partnership between Jeffco commissioners and Adams County commissioners, along with our mayors as well, and our city managers and many others.
Indeed. I'm curious what you're hearing from your constituents right now, Commissioner, and what are some of their greatest concerns on the Jeffco side?
Sure. I talk with constituents regularly, business owners, food bank leaders, community members, and many others. 1 in 4 businesses in Jefferson County has closed. Our food banks are seeing a 30% increase in new clients coming for help and extra assistance. So concerns largely focus on how we work together as a community to get this virus under control. How do we keep our businesses in business? We just heard from one of your local business owners. How do we get our kids back in school? How do we meet the need for food and rental assistance, which is skyrocketing? And above all, how do we keep our family and friends safe and healthy?
As you know, better than me probably, there is pushback to a lot of the messaging that we're trying to get out there once again to encourage people to be vigilant and wear those masks and the simple things we've been talking about. What do you say to people who, and I asked the Commissioner Penter the same question, what do you say to people who are just, look, I'm tired of this, I just want it to be over, please can it be over?
I understand completely. We understand, and you are not alone, no question about it. All of us are feeling fatigue, not just here in Adams County or in Jefferson County, but across Colorado and frankly, around the globe. You've made so many sacrifices to keep your community healthy. And on behalf of the Jefferson County Board of County Commissioners, I want to thank you so much for all you do and all you continue to do throughout this pandemic. It is tough, it's trying, it feels never ending. But one thing we know for certain is that lives depend on our individual decisions. And I have to repeat those messages you heard earlier from City Manager Tripp and from Governor Polis. Continue to wear a mask, physically distance, avoid those social gatherings, and please stay home if you're able. These are basic precautions that make a world of difference. They do save lives. Talk to any hospital or healthcare worker and they will tell you this. One other bit of news to share too, the Jeffco Fairgrounds just opened a new testing center and we welcome you to come and get tested. It's free. There's more at jeffco.us. Just click on the COVID-19 tab.
And we appreciate our partnership with Jeffco in Jefferson County, both the commissioner side, but also on the health department side as well. We couldn't do a lot of what we're doing on the other half of our city without those partnerships. Real quickly, we're almost out of time here, but as a former journalist who won a lot of awards for your coverage on education in particular, what concerns you most about the impact of COVID-19 on our kids, our young people, our students?
Sure. Thank you. Thank you, Greg, for that question. I also happen to be the mom of a high school senior, and I've seen firsthand the impact the pandemic is having on our kids, on our teachers, on working families. And first and foremost, we've got to keep everyone healthy. We also have to ensure that our students and families have the resources that they need to be successful, whether it's access to the internet, whether it's expansion of bandwidth, whether it's access to grab and go meals, because we know kids can't concentrate in a remote learning setting if their stomachs are grumbling or they're hungry, or if they need extra support services, especially our differently abled students. So our teachers, our principals, our paraprofessionals and school staff, they are stepping up in truly heroic ways, because none of us wants to see any of our kids lose any momentum when it comes to learning.
Commissioner Dahlkemper, thanks for all what you're doing. Stick around; we'll bring you back on a little bit later in the program. But for now, thank you for those words of wisdom. Again, if you're looking for specific resources on Jefferson County, their website, as Commissioner Dahlkemper mentioned, has tons of information for you. Just go to jeffco.us. City Manager Don Tripp of Westminster mentioned our partnerships with other municipalities for this evening. It is now my pleasure to bring on those partners right now. The City Manager of Thornton, Mr. Kevin Woods, City Manager Heather Geyer from North Glen, and City Manager Jane DeSessa from the City of Brighton. All of you, thank you so much for taking time. I know how busy you are, so I appreciate the time. It's great to see some of my old friends, and I'm glad you're staying safe and healthy. Kevin, we're going to begin with you. Talk about how your community is dealing with this latest surge and how folks are holding up there in Thornton.
Well, we're suffering the same spikes in numbers as everybody else in the region, unfortunately, and we've done a lot to try to mitigate that. Recently, well, over the last 9 months, we've taken the CARES money, which was about a little over 11 million from generously given us through Adams County, and established about 17 different programs focusing on businesses and individuals and families. About half of that money, about 5 million, went to businesses support. The other half went to individuals and families. And it's been pretty effective, and we'll wrap that up this week. This Friday ends that program. However, we will turn the corner and have another 500,000 focused on individuals and families available to us through CDBG. What we've done lately in recent response to the spike was try to put out more information. So we pushed out a considerable amount of signage on the streets even, as well as communicating business to business with individuals, volunteers from our workforce going out and visiting everybody. And also pushing compliance. And believe it or not, we've had extreme success with our businesses. About 99% of our businesses that you visit are in compliance, mask, distancing, and availability for any kind of PPE if needed. So it's been pretty effective in that sense.
That's pretty amazing.
But still, we're working on it just like everybody else, and we hope the light at the end of the tunnel is now starting to show.
Let's hope so. Thank you, Kevin. We'll get back to you in just a minute, City Manager Kevin Woods. City Manager Heather Geyer. Heather, it's good to see you, and I know you have been working hard in North Glen as well to get the message out and the importance of stopping the spread. What has been the reaction of your businesses and community to those messages, and what kind of success are you seeing?
Thank you, Greg, for the opportunity to be with everyone this evening. I would say the response in North Glen has been overwhelmingly supportive. Certainly, we've heard mixed messages on our social media channels. However, so much looks different right now, aside from the fact that the heart of our community remains so strong. And that's because of our residents, our businesses have just really come together and stepped up and have been tirelessly working to make sure that this community has what it needs to move forward. Our staff, our elected officials, city council members, our mayor, collectively, everyone has put differences of opinion aside and really focused on what do we need to do the right thing for the city of North Glen and to keep our residents safe.
Indeed. And the partnerships that it takes to do that too, because I know Northglenn has been doing a lot of that work. City Manager DeSessa with Brighton, thank you for joining us. You're fairly new in the position there in Brighton, but I'm curious to hear how businesses and residents in Brighton are holding up in your community and what kind of impact you're seeing right now.
Well, I think we've heard so much about this, and first let me tell you that thank you very much for including me in as part of this program. You know, I'm really proud of the efforts that we've done in order to support as many of our residents and businesses here in Brighton that have been impacted by COVID. You know, we've spent over $2 million through our CARES Act funding to support our residents and businesses in many ways. And for us here in Brighton, one of the things that I'm really proud to mention is that, you know, we were the first city to create a revolving loan program with the Colorado Enterprise Fund that offered an estimated $1 million of funding to our businesses. And this was at the start of the pandemic. So I'm really proud of that. And then also, you know, we've created programs that have provided more than $1 million in rent and mortgage assistance to our residents and businesses. And we've provided things such as assistance with water and bill assistance, meal boxes through our food program. We've also provided protective equipment. And then finally, and I guess this is really important, is that we partnered with individuals such as Adams County to help facilitate a mobile rapid testing site in our community for our residents and businesses. And that's been very, very impactful. We've seen almost 5,000 people tested at our site. This has been done since this past September, so we're very pleased that we've been able to provide that very valuable service. I guess the only thing I have to say about that is that this site is only available until December 19th. And for those of you that are interested, it's being held at the Riverdale Regional Park, and that's located at 9755 Henderson Road in Brighton.
Right.
And the last thing I want to say is that it's in it's available to residents of Brighton and to employees of businesses here in Brighton.
Great.
So we've been a positive response.
And we'll refer folks to your website too for more specific details. I'm going to ask all of you the same last question now and ask you to, in a minute or so, just sort of recap your message of hope for your residents and businesses of your individual community. City Manager Woods, I'll begin with you. What is your message of hope for your community right now?
Speaking for the council, I think they would echo what I'm going to say, which would be there is hope. The city is here to help whenever possible, in any way possible. You can reach out to our website. If you continue to mind the rules that we've asked for, social distancing, etc., I think this pandemic is going to find its end sight soon.
Very good. City Manager DeSessa, I'll let you weigh in, or actually City Manager Geyer, go ahead. What is your message of hope for the residents of Northglenn?
My message for my residents of Northglenn is your local government, rest assured, is working tirelessly for you. When in doubt, give us a call if you need assistance with something. We want you to be safe. We want you to be healthy. We're here at your service, and we know that we can't get through this alone. So we're going to continue to get through this together collectively as a strong community, and please just reach out to us and let us know if there's anything that we can do to help you.
Very good advice. Final word goes to you, City Manager DeSessa.
Oh, thank you. Of course, I have much of the same message here. I guess first and foremost, like everybody's been saying, there is a light at the end of the tunnel. And I guess that's the message of hope I have for everyone. These safe and effective vaccines are on their way. But of course, it's very important for all of us to not let our guard down, especially at this critical time. Now more than ever. I know we've said this many times, but I guess I need to repeat this one more time. It's important that we continue to maintain social distancing, that we wear a mask, that we limit our gatherings as far as we can. And then the next few months are critical. And I couldn't lastly agree more with Heather when she says, above all, and I want our residents to know this, that we are here for you. We're calling on everyone to take action now, so that we can all move forward together. And as she said, we can't do this alone.
City Manager Kevin Woods of Thornton, City Manager Heather Geyer with Northglenn, and of course City Manager Jane DeSessa with Brighton. Thank you all so very much for once again having another late night and joining us with some very wise words. Here are the references to their website. Specifically, if you have questions about what's going on in Brighton, go to brightonco.gov. Again, they have so many different programs available. Northglenn.org has lots of information about support programs for businesses and residents, and they also have rapid testing going on there. Thorntonco.gov, as you heard City Manager Woods mention, they have many new programs coming online right now. You'll want to be sure to check that out as well.
I'm Zanaya and I'm a junior at Westminster High School. COVID has changed me because I'm not around a bunch of people. This school year has been kind of hectic. Online, it's just hard to be motivated and get up every morning to go to online school when you're not in person, so you don't really understand what the teacher's trying to say. What I miss most about being normal is that I could go to my friend's house, not have to worry about being sick or getting my parents and grandparents sick. Other kids out there around my age, I know it may be hard to breathe throughout the mask, but to make things better and to have anything normal, it's worth it at the end of it. Stop the spread.
Stop the spread and help our students and help our schools. They really need it right now. You know, a lot of people have questions about how to deal with this pandemic from a health standpoint. You know, how do I celebrate a family get-together right now? Is it safe to do that? We're leaning into the holidays, the second round coming up here with Christmas and other big celebrations. How do you do it safely? Well, we have asked an expert in the medical field to join us. Kelly Kanapik is the infection prevention manager with SCL Health, specifically at Good Samaritan Hospital. Kelly, thank you so much for joining us. It's great to see you again. I have heard you speak, and I was so impressed with the work you're doing. I don't want to put any pressure on you, but thank you for sharing your words of wisdom. But before we get into specific questions, I want to know what you're seeing from the frontline perspective here. Doctors and nurses, what are they experiencing right now?
Yeah, it's been really tough right now. We're seeing increased numbers of COVID in our hospital, and our ICUs especially are really full. We're seeing more COVID patients now than we ever did in the spring, so it's been tough. Our teams are tired, but we're working hard. We're pulling together. We're drawing on all of our resources to continue to care for our communities. We're really hopeful because the treatments are a little bit better than they were in the spring. As this goes on, we're learning more about the virus, learning how to treat it, and we're really excited to see that the vaccine is coming out soon, hopefully.
Yes, hopefully. We are hearing it's just a couple of weeks away for medical professionals for sure, and those frontline workers. Now let me dive into some of the medical questions that we get quite often. And this one may sound like very common sense, but a lot of people are asking this. Why have state and counties implemented social distancing, and why are they so insistent on mask wearing?
That's a great question. So we know the virus spreads primarily through respiratory droplets. It can spread on surfaces, but its primary route is the respiratory, coming out when you speak, when you talk, when you're breathing, coughing, things like that. So physically distancing allows the virus to fall to the ground before going to somebody else. Wearing a mask, as Governor Polis said earlier, really does protect you from spreading the virus, from getting the virus. So it does decrease that transmission. There's a great study out, an article from the CDC, that they looked at a couple of hairdressers that tested positive for COVID, and there were 139 clients that they saw while they were contagious with COVID, and none of those clients got COVID from those hairdressers because everyone was wearing masks.
Wow.
So when you think of how close everybody is in those kind of settings, no transmission is awesome.
Right.
We also know the state's, turning up the dial. We're getting a little bit more restrictive because we don't want to have a situation like New York had in the spring, where the healthcare systems were overwhelmed, the healthcare workers were overworked. So we want to be able to provide good care moving forward. And hopefully, if we can slow the spread of the virus with these things, fewer people will get COVID before that vaccine becomes available.
But let's be honest, Kelly, it is extremely challenging to observe social distancing with family, particularly family who don't live in your home all the time, especially this time of year. But what is your best advice to have a safe and healthy upcoming holiday season?
Yeah, so before celebrating with your family, check your county's level on the dial. That's going to tell you kind of what's happening in your community. Right now, all of the counties around here are in that level red. So it does mean that the safest way to celebrate the holidays is with your immediate household. You can get a little creative around that. So you can always do a dinner together with a video call. Another one that I really like is everyone makes some sort of signature dish and you drop it off at each other's houses, and then you can all eat dinner together, that same sort of dinner together while apart. We've mentioned it earlier, supporting your local restaurants. Maybe this is the year you don't cook and you go out and you go get food and everyone gets food from the same restaurant, so it feels like you're celebrating together. Yeah. It is really tough not to see your family and friends, especially this time of year. But the sacrifices that you make this year help it so that our hospitals can continue to care for patients, and it might just make it so that you can spend another few Christmases with those family members that you love.
Great advice. And I would just encourage my family, if they're watching, please drop off those meals as frequently as possible. I'll be checking the front door. Another very common question we get, is there such a thing as testing out of quarantine?
So up to a couple days ago, I would have said no. There was some new guidance, though, that came out from the CDC. So there's a little bit of a caveat with this. If you have been exposed to COVID, the recommendation is that you quarantine for 10 days past exposure. And as long as you're asymptomatic after those 10 days, you can go back to your life. If you are still asymptomatic at 7 days, you can test out of quarantine if you've been tested, the 6th day or the 7th day. And then at the end of that 7th day, if you're negative and still asymptomatic, you can be out of quarantine. Under no circumstances can you test out of quarantine before those 7 days are up. And as this is new, this did just come out.
Yes.
This is what we are following now at this time. And then as a reminder, if you do have symptoms, you want to get tested right away and not go out into the community.
Kelly, great advice as always. Thank you so much for taking a little bit of time this evening. I appreciate it, and we will see you again soon, I hope. Kelly Knapek with SEL Health and Good Samaritan there. You heard Kelly mention the CDC coming out with updated guidelines. They come out with them almost daily now. The most recent was just about 24 hours ago. CDC.gov, besides your state and county health departments, this is another great resource for you to make sure you check out.
COVID has added an increased stress level on everybody.
I think it's taken a hit to our crews through all Westminster.
Normally we like to get on scene, get inside, meet my patient, and unfortunately what COVID has done is it forces us to take a step back.
Where we used to be able to comfort and connect with patients and families of our patients, now there's an added distance.
High rate of COVID cases we're seeing in March, we're right back there today.
And what we're seeing now is I'll go to homes and there will be multiple people in that residence, all with COVID. They're your neighbors, they're your co-workers, and people you care about.
I think Westminster is coming together as a community as a whole, but we still need to reinforce the importance of always wearing your mask.
That's the best, most selfless thing we can do right now.
Let's work together, Westminster. Stop the spread.
We want to thank all of our colleagues of the Westminster Fire Department for getting that message out. And in that video piece, you heard them mention that it impacts our family, our friends, and our coworkers. And it is with extremely heavy heart that we bring you some very sad news from our Westminster Police and Fire Departments. This gentleman that you see in the picture right there on the screen, Gary Pedigo Sr., passed away Wednesday morning from complications arising from COVID-19. Gary's life was devoted to serving our community. In fact, he began that service on February 17th, 1976, when he joined the Westminster Fire Department as a firefighter. His servant's heart spent the next 36 years helping people in Westminster through various roles, responsibilities, and many, many accomplishments in fire service. He did eventually retire after those 36 years, but if you knew Gary, this was not long enough for him to continue to serve, and he wanted to keep on going. So 5 months later, after retirement in 2012, he joined the Westminster Police Department as an equipment services technician. Gary was a husband, 47 years married to Jackie, a dedicated father to 4 children, loving grandfather to 15 grandchildren, and 9 great-grandchildren. Rest easy, sir. Gary Pedigo, we'll take it from here. I want to introduce you now to a health professional who has been dealing with this pandemic almost 24 hours a day, 7 days a week since it all began and breaking back in March and April. with the Tri-County Health Department. This is Executive Director John Douglas. He is a wealth of information, and we hear from him frequently, but we're honored to have him joining us on this program tonight. Dr. Douglas, thank you for being on.
Great to be with you, Greg. It's a great panel.
We have heard a lot already this evening about where Adams County is and our municipalities on this COVID-19 dial as of today. But based on your experience, though, I'm very curious, and what you're seeing with some of the new directives and restrictions that you've released, is this going to be enough to keep us away from going into even further restrictions?
You know, I really hope so. We've been in the red level since the Friday before Thanksgiving. We have seen a drop in numbers of cases since about 3 or 4 days before that. So I'm cautiously optimistic that the measures that have been taken as part of that, as well as the spirit of the community in trying to get through this, is going to be sufficient. But I'm also a realist. I worry that Thanksgiving gatherings, travel during Thanksgiving, could create what Dr. Fauci, the NIH infectious disease guru, has told us could be a surge upon a surge. So we're watching this next 4 or 5 day time frame with great anticipation, hoping we continue our progress, but wanting to be sure we detect the first sign of potential reversal.
Right. You know, Dr. Douglas, you know better than I do that it's very difficult to pinpoint exactly what's causing this recent surge, the behaviors that are causing that. You have some strong theories, though, and I'd like you to talk about where the numbers are pointing to when it comes to transmission these days, because I think that's pretty interesting for people to know about.
Yeah, well, I think, let me begin by highlighting that 1 in 41 for Colorado and 1 in 39 number that got mentioned earlier. And I highlight that because honestly, when we go out now, it is so likely we'll run into someone with COVID that the things we got away with in the summer, we're just not going to get away with now. So when we look at information we collect from individuals who've recently been diagnosed with COVID, and we try to find out where they could have caught it, the number one answer we get actually is, I don't know. I don't have any idea. And then we try to coach them through possible explanations. And the second most common answer we get is a personal gathering of some kind, a small gathering. Sometimes it's a larger gathering. It's just our natural human inclination to be with our friends, our loved ones, our neighbors, et cetera, et cetera. I will say that we do hear after I don't know, and after personal gatherings, that restaurants have been cited as being places where people were when they could have been infected, and after that, workplaces and houses of worship. In none of those places can we be absolutely sure that that's where the infection came from. So you're correct, Greg, it's a theory. Yeah. It's our best information. It's consistent with what we hear from other places, so I think it's likely real. But I want to emphasize we're going on our best hunches at this point.
Dr. Douglas, I'm going to pause here for just a moment. I'm going to ask you to stick around because we're going to bring back folks on for our Q&A panel here. Sure. But before we start with our question and answers, I do want to bring up your website at Tri-County Health Department. You've got some great resources and all kinds of up-to-date data. It's easy to find. Go to tchd.org. That's tchd.org. We're going to enter now our question and answer phase for just a few minutes left that we have in our program. I'm going to bring back Dr. Douglas. I'm going to bring back Commissioners Pinter and Dahlkemper and City Manager Don Tripp. I believe you all are back with us or will be here in just a moment. And Dr. Douglas, I'm going to start with you with the first question. I know we just talked to you, but I've got a question about actually some positive news and a lot of hope coming out now because of the vaccine. From your perspective, tell us where we are in the vaccination progress and when are people in our residential areas going to start seeing that vaccine and being able to take advantage of that?
Yeah, so let me say that as bad as COVID has been, and it's been the worst public health experience of my career, the COVID vaccine is probably the most exciting development of my public health career. To see a vaccine developed in less than a year, ready to be administered. We expect that we're going to be getting doses shipped to Colorado as soon as next week, and we're going to be ready to begin to distribute them to hospitals so those critical hospital workers can be first to receive vaccine. there's an allocation framework that will, after healthcare workers, next include residents of long-term care facilities, and then essential workers such as fire, teachers, grocery store workers. We are then going to be getting to the more general public, first with people with higher risk conditions and then everybody else. That the big question is, when will that be? I think that's likely to be April, May, June. It may take us till the end of the summer for everybody to get their second dose, because it is a 2-dose series.
Right.
But I think that's the framework we think we're working with at this point.
Thank you, Doctor. Commissioner Pinter, I've got a question that came in off of Facebook right now, and this has to do with housing in Adams County. What options are available for families who are struggling with rent right now, or the ability maybe to purchase the necessities? We're talking food in this case. I know Adams County has dived a lot into this and leaning into it in a big way.
Yeah, absolutely. So I would redirect folks to our website. You can just go to the Adams County website, and there'll be a big banner at the top to our COVID site. It's adamscountycovid19.org. And on there, you're going to find links to all the different types of assistance we have. There are a number of food banks who have gotten supplemental assistance through CARES dollars. Our school districts are distributing food weekly. We are in Adams County. Westminster is. And there's a lot of food available, and that can help with that family budget. There's also additional scholarships available for childcare, and some of that money came down through the special session, because you know when you're working on that family budget, you gotta take those bites from a lot of different places. There is also rental assistance available. We just allocated at the county several more $1 million to support our rental assistance program. So if you're still in need, go to the Adams County website, adamscountycovid19.org. And that'll redirect you to rental assistance and to some of these other programs.
Thank you, Commissioner Pinter. Commissioner Dahlkemper, this is a question we're getting quite a bit this evening about mental health. What about mental health for residents during these very tough times? What kind of resources are out there and available right now?
Well, it's a very important question. It's an issue that many of us struggle with. These are very difficult times. Many of us feel isolated. We feel alone. We don't have the usual contact that we may with friends and family, and that's difficult. There are incredible organizations. In Jefferson County, there's the Jefferson Center for Mental Health. There are online options in terms of mental health services and programs, and lots to look at. I would encourage you to go to the Jefferson Center for Mental Health website and talk with some of the folks at the Jefferson Center. They're an amazing group of individuals. You can also go to our website. Just like Commissioner Pinter mentioned, we have something similar here in Jeffco at jeffco.us. Again, click on that COVID-19 tab, and that will take you to a number of resources that we offer here in our county, including mental health support and services. Yeah. Don't be afraid to ask for help. It's there and it's out ready for you.
That's really important advice there. Don't be afraid to ask for help. Commissioner, thank you so much. City Manager Tripp, I'm going to bring you back on right now for the final question we have time for this evening. And we want to thank everybody for all the questions they're sending our way. We just unfortunately don't have time to get to all of them. But Don, this is a tough one. And I understand this question. I don't know how you answer that, but you're a man with a great heart. I know you've got some thoughts. What do you tell business owners who have lost their life work or are in the middle of potentially losing their life work right now? That's so tough.
Well, I would tell you, as my colleagues have said, your city is here for you. You make contact with us. We have many programs that we have in place to assist you with rent, with paying bills, with keeping you in business as long as you can. And I want to tell you how much I appreciate and I applaud your resilience. It's been unreal the way our business community has responded to all this. I'd say hang in there. Help is on the way. As Dr. Douglas said, we've got a vaccine that's near. We also have additional money coming from the federal government. Commissioner Pinter's right. We need more, and I think that'll come too. You've gone through the toughest part of this, and you've adjusted in a very significant way to serve our community, and we thank you very, very much for that. And we will meet you on the back end.
Yeah.
Please hang in there with us and know that we're in your court, and Like the other managers on the call, we'll do everything we possibly can to help you survive this.
Don, thank you for that. And it's really a call to action to all of us who are watching here this evening to do what we can to support our small businesses, especially our restaurants who are now back to a very challenging situation. We do applaud you, we honor you, and we are there for you as much as we possibly can be. So thank you to all of our panelists who helped us with our question and answer. We do appreciate it. Thank you all. We have some parting words now, actually, from City Manager Don Tripp, who's a very wise guy and a wise man with some great insights into what we're doing in the City of Westminster.
Hello, I'm Don Tripp, City Manager of Westminster, Colorado. I'm here at City Park, one of my favorite spots in the entire world. There are fantastic views here and lots of friendly people. But it's very different now because of COVID-19. As I pass people with my mask on, I simply give them a wave. The great smiles we miss, but the waves are terrific. We are many months into the pandemic and fatigue has set in. So it's going to take all of us pulling together to protect our family and friends. Our choices may be individual, but they make a big difference for all of us. That's why we're calling on everyone to take action now to keep Westminster safe and open. Here's what you can do. Wear a mask to protect yourself and others. Watch your distance. Keep 6 feet or more apart. Wash your hands often. Scrub for 20 seconds with soap and water. If you're sick, stay home, get well, and don't spread germs. Limit personal gatherings, even though it's hard with special celebrations this time of year. And be kind to one another. We really need each other in this time. We made it through other surges during the pandemic, and we can step up and do it again to keep Westminster safe and open.
Let's keep Westminster safe. Let's keep all of our cities safe and our neighborhoods, our friends, and our families safe and healthy as well. Once again, a huge thank you to our municipal partners who joined us in this endeavor tonight, the City of Brighton, the City of North Glen, the City of Thornton. On behalf of all of us from the City of Westminster, I'm Greg Moss, just representing one of over 1,000 people who are not here with me tonight, but who care a lot about you and are here to serve you every day. Again, thank you. And stay safe and healthy. Good night.